in place for deciding if we're going to adjust the lockdown. The first is around NHS capacity, and we're in a good position on that one. The second one is about a sustained and consistent fall in daily deaths from coronavirus, and it is now very clear in the data that we are past the peak. The next one is solid information that the rate of infection is decreasing to manageable levels right across the board. This is an indicator that we need to keep a close eye on over the next few days and weeks. The fourth one is around operational challenges around testing and PPE and being able to meet future demand. There are continuing challenges on PPE. It is an absolute priority to continue pushing on this to get it right in the long run. But of course, on testing, as you've heard from the Secretary of State, we're in a very good position. And finally, we have to be confident that the adjustments we contemplate are not going to risk a second peak of infections. And this is really a matter of deep scientific discussion, very, very close following and absorbing of the evidence, and one that we're keeping under detailed scientific review as the days and weeks.
And in normal times, it's usually pretty accurate.
Now, this slide actually shows search data of people looking at Apple Maps for directions over driving, over walking routes, or over using public transport. And it tells the same story as slides you have seen before about how since we announced these social distancing measures, the public continue to observe the instructions, to work with us, to work to protect the NHS and get case numbers down. And you can see very, very consistent trends over reduced searches for driving instructions, walking instructions and use of public transport. So we need to keep going. Let's keep going and continue to drop the curve further. Next slide, please. These are, this is a graph showing from the 6th of April through to the 4th of May. Daily tests completed for coronavirus, and you can see on the right-hand side the latest data showing 85,000 tests completed on the 4th of May. Our capacity is 108,000 tests, and there is another lab opening next week. So this is all very encouraging. Tests are going up, people are using testing services more, and we are well within our capacity capability. Next slide, please. Now, this slide shows new cases of coronavirus in the UK. From the 21st of March, you can see that obvious peak up to a high level in early April. And then you can see the pattern that has occurred in terms of new cases right up until the 4th of May. On this one, I have to say that new cases need to come down further. We have to continue to track this index, and we have to get cases lower. If you look to the next slide, please. Here we array the number of people in hospital with COVID-19 from the 17th of March through to the 3rd of May. And after peaks in the middle of April, you can see that in almost all areas now, there are steady but absolutely consistent declines occurring. Possibly in a small number of areas, the trend is somewhat flat, but overall, there are now steady declines in the number of people in hospital. This is good news. Following on, please, the next slide. Critical care beds, ICU beds. Here again, across all 4 nations, you can see largely continuing declines, and possibly a more important point, if you look at the axis on the left of the slide, the y-axis, you can see where we are in terms of capacity, and there is plenty of ICU capacity, which is extremely good. Next slide, please. I turn now to deaths in all settings, and here you can see that there is a slow but consistent decline. You will see the weekend effect very clearly, especially if you look at the 3 steps on the right-hand side of the chart. Fewer deaths are actually reported at the weekends. That's an artifact of the way people report deaths. But overall, if you look at the orange line, the 7-day smoothed out rolling average, there is this slow but consistent decline, which is absolutely going in the right direction now. And then the final slide is one we have shown for some time, showing a comparison across countries, dating back to the day when 50 cumulative deaths were recorded in each of the countries. And we're now quite a way across the slide to 60-odd days in some of the countries. The message is the same, as I've said to you before, that there are kind of 3 broad trends on this curve, but I do want to emphasize to you, these are numbers, they are not rates, they do not adjust for the size of the underlying population, and this is a difficulty in interpreting these data. We will, in the course of time, be able to get all-cause, age-adjusted excess mortality for many of the countries on this slide, and that will give us a much clearer understanding of what is going on, and hopefully those data will continue for a long period of time so that we can understand the fullness of the picture as we try to beat this virus. I will stop there with the data and hand back to the Secretary of State.
Thank you very much, Jonathan. And we're now going to take questions. And the first question is from a member of the public. We have a video from Sack Lane from London.
What is being done to ensure that BAME key workers are not disproportionately affected by COVID-19? And what steps are being taken to provide support to the families of those victims who have sadly passed away?